Data Reform is an initiative that tries to bridge the gap between policy and healthcare system improvement. So we are trying to create a space and an opportunity for conversations from the policy side of the spectrum and the healthcare delivery side, and hope that we can foster good conversation, dialogue, brainstorming, solutions, and move Washington forward here as we're implementing reform.
So Washington State, Puget Sound, Spokane, it's for you. And this kind of change is possible, maybe only at the level of the communities represented in the room. The bottom line is we have the answers. I'll show you a few. This one you know well. You've studied it here in Washington quite a bit to your advantage. In Alaska, it's a team-based, population-centered system where specialists are like teachers rather than gerbil cage runners. And the orientation around health is quite real. Let me show you NUCA's results. Redesigned care. 50% decline in ED utilization, 53% decline in hospital admissions, 65% lower specialty utilization, 20% reduction in primary care, 75% tile performance in all quality metrics, 75 to 90 benchmark levels, and the highest rate of satisfaction in patients and employees that they've ever had.
The goal, starting from the top, is that everyone would be able to talk. Every system would be able to talk. Physicians' offices, outpatient clinics, hospitals. But in order for us to get there, we have to have collaboration, we have to work together, and we all have to give something up. So I can't have everything, you can't have everything, but collectively, together, we can make this happen.
What we're doing, which is very elemental, is essentially establishing commitments between providers, between care settings. So it's between people and practices around service. A basic measurement around the tenet that I serve you, you serve me. We're sometimes customers of each other, sometimes we're providing services to each other, right? We measure that. It's had profound implications in terms of performance.
I'm excited about what I'm seeing, and one of the reasons I happily decided to come out here was because I'm excited by the states more than the federal government right now. Massachusetts, my own state, is pretty exciting right now. We've got universal coverage. We're over 99% now. Arkansas is doing amazing stuff with bundled payment now. I think Maryland is going to be taking advantage of its all-payer system in a very creative way. Vermont may be the first state that goes to single payer. I don't know. Some of them want to. Oregon, what Dr. Kitzhaber is doing, Governor Kitzhaber is doing with coordinated care, there's real meat there.